So, yes, we know that the concept is used internationally and in other disciplines, but I'm not sure what other people's experience, but generally, when we present at conferences and use this term and this concept, it's not widely used in other countries. So we know that what we are looking at with cultural safety is about health practitioners having that initial I guess, internal debrief about themselves, their actions, and how those actions related to their cultures impact on health interactions when they're caring for people from different cultures. So we really ask our health professionals to consider activities, values, communications, assumptions about themselves rather than feeling this need to learn about everybody else's culture, because that's a huge, huge ask. And Sandy, I really like the way that you broke that down in your piece in the newsletter. So I'd refer everybody on to have a look at some of that, and happy, if you're happy, Sandy, maybe share that with this webinar as an adjunct to it, because I think there's some really good breakdown there of us acknowledging ourselves and what our norm is so that we can more openly care for others. Next slide, Elizabeth. So the other really important part of cultural safety is the putting advocacy front and centre. So it's very much about in recognising your own self and what your values are and how you function as an individual, but also within your culture, that you are better able to look at the rights and legitimacy of others. And I just thought this was a really nice snapshot of what we are looking at in cultural safety, where it is very much about advocating for a client, a patient, a consumer, regardless of what their cultural background is. So as we said, just to summarise, really understanding oneself, and we spend a lot of time in our life, both socially and professionally, understanding why we respond in the way that we do, and understanding what makes us make the decisions or provide information in the way that we do. And again, that real imbalance of power for health professionals, where we very much acknowledge that it is the health professionals who have the balance of power within our health system. So in order to make some changes around that balance of power, we need to truly recognise diversity and that everybody is different. And we can often just talk about, acknowledging that everybody's different, but we actually are, even within even within our own culture, we have a lot of differences in what we believe about healthcare, self-care, working with others, caring for others. So recognising that and also respecting the difference. And in some cases, we need to significantly modify practices to be able to accommodate that difference. And modifying those practices means that healthcare professionals need to look at how they're delivering care, why they might deliver it in a particular way, and is there a way that they might deliver it that is more acceptable, is more accessible for clients, so that we're truly advocating for every consumer who walks through our doors, regardless of where that is. I think I'm repeating myself here, but I think it's really important to acknowledge that it's not just about ethnicity. These power differences and variation are really important, that we not only look at those power differences between us and consumers, but also the variation within cultures. So again, it would be a huge task to try and understand every other culture, but it can often be a really simple case of asking, how can I help? How could I do this differently? What do you need from this service? What's concerning you about visiting us today? What might make a difference for you? And really acknowledging that one size doesn't fit all. So the other thing that as nurses we can try and do is develop that understanding of predominant cultures of the families that live within our community. I always tell the story of the first time that I went to Logan Emergency Department. And Logan it's now a city within southeast Queensland, and you drive up the ramp to the emergency department and it actually says welcome, and that it's an emergency department in 12 different languages. So that's just within one suburb in Brisbane. Well, they're not actually Brisbane, but the fact that they had looked at the predominant cultures within that community and made sure that, most of the people presenting, I believe there's nearly 50 different ethnic groups living within Logan City. So they've captured the majority, the predominant cultures. And it's just a really good reminder that we are different and we live in a very multicultural society. So as health workers, focusing on the family that you're caring for, their agenda and belief system rather than your own, becomes really important. And we have to ask the questions. We can't just assume that we already know. We have to very much ask the questions. So when we read the literature, a lot of the terminology that we see relates to cultural awareness, cultural sensitivity, cultural competence. But when we look more broadly at the terminology around culturally safe care, it encompasses all of those. So it's that acknowledgement that people are different, that we become more sensitive to the difference, we acknowledge and respect the difference. And then cultural competence relates to what we as the health practitioner does and how we do that. So there's 3 quite different concepts within that, but they all come together around this notion of providing culturally safe care. So that particular linkage comes from a Canadian collaboration centre for Indigenous health, but I think it really nicely summarises the different concepts. So, as I said, our First Peoples in Australia, 3-ish% of the population, but over many, many years and many mistakes and many injustices, there really is that recognition that if we can improve, change, really be conscious of providing culturally safe care for Aboriginal and Torres Strait Islanders, when they're using our healthcare systems, we will actually improve access to as well as the quality of healthcare. So a health system where we really acknowledge and understand their cultural values, look at some of the strengths that come from cultural history and knowledge that is shared, and that we respect those differences, then we can really start to address those issues related to inherent racism and inequity. And we'll often see, discussions around, well, does everybody get the same care? Is it equal? Is it fair? It's more about equity. And we've all seen the pictures of the box where, to be able to see over the fence, we don't all need the same size box, but we all need to be able to see over the fence. And I think equity in healthcare in Australia is something that has been poorly addressed over many, many years. So our national Aboriginal and Torres Strait Islander health plan, which was developed 3 years ago, looks at a lot of these issues related to cultural safety and about ensuring that there is equitable access to healthcare that's appropriate and accessible, and that we are advocating for First Peoples. We've had an increase in the number